Kasi i-edit naman yun eh. Kasi,
Ikaw mag-edit. Kasi basta.
teka. Decisive. Check.
Bumasa kayo sila sa ganun.
Okay. What specific skills are needed to perform this job? Specific skills. With regards to the specific skills, we have some duties and responsibilities as a clinical pharmacist. So we try to check the correctness of the drug prescribed by the doctors or by the physician. At the same time, we try to check any incompatibilities, any drug-drug interactions. So with regards to this matter, so we have to become more decisive as far as the medicine related or drug related issues are concerned.
So, can you kindly describe to us the nature of your work in terms of responsibility and role in the field of pharmacy and medicine?
As a clinical pharmacist, unlike in other practice of pharmacy, so we are inclined in patient interaction. We are also try to talk with the physicians and with the nurses on how to deliver the correct dose of the drug. So basically, that is the essence of doing job under the clinical pharmacy program. In the role of the field of medicine, so if you have an experience as a clinical pharmacist, since we are dealing with the patient, so basically if you will pursue your career in medicine, you want to become a medicine student, so it will be easy for you to deal with this patient since you already have an experience as a clinical pharmacist.
Based from your experience, what are the advantages and disadvantages of being a clinical pharmacist? And what is the best and worst thing about clinical pharmacy?
Advantage, we are more inclined in the recent knowledge or the recent development in the drug. So that is one of the advantage of being a clinical pharmacist because you actually see the drug itself as is. Okay, more on the actual scenario. But the disadvantage is it will depend on the nursing unit if you assign in a nursing unit that will occupy a large bed capacity, so that will be a burden on your part. So you might have any stress-related sickness or illness because of the, let's say, you might assign in a graveyard shift, something like that. So that is the disadvantage, and most probably the worst thing about clinical pharmacy.
So, describe a typical day for a clinical pharmacist.
Interaction with the patient, we do the patient counseling, we visited the room of the patient, and we have interaction with the nurses, with the doctors. So there's a camaraderie among the allied health professionals and at the same time, patient as well.
Are there any perks of being a clinical pharmacy?
In St. Luke's, one of the perks is we have an interaction with the celebrity, something like that, and then that's it. I think that's one of the perks based on my experience.
What makes clinical pharmacy distinct from the rest of the field in pharmacy?
Distinct in such a way that the importance of the pharmacy is there. Okay. Although the importance as a pharmacy in the community is also seen in our society, but if you will work in a hospital and you want to you want to check the patient through the patient chart and you want to visit them. So there's a feel that you are really the part of the allied healthcare team. So that is, I think, an idea that would be distinct from other discipline of pharmacy. So,
What advice would you have wished to receive while you were still a student that would apply to your profession now?
what advice? Well, teka cut muna.